You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host, Fahad Matin, today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that all of us are had a nice and positive week so far and looking for a nice and chillaxing weekend. This program is live and broadcasting live today on Thursday, 11th of July 2019, and casting its positive vibes to all our lovely people in Luton. Our positive vibes going all across Luton and the surrounding areas of Luton, like Dunstable, Harpington, Bedford, and definitely from our website and from our apps, going all across the UK and world. And yes, indeed, you can view us via Facebook if you want to. You can all simply have to go to Inspire Facebook page and just type Inspire FM on the Facebook page and click our live video link. If you're listening to the show on Sunday or any other Thursday other than 11th of July in 2019, that means it's repeat, but hey-ho, it is not today. As we all know, we cover different health information topics every single week, and sometimes we do try to introduce some new topics, like today. So one of the topics which we are discussing today is a very unique and very new topic in many different ways. Some of us already have no idea what this topic is. And that means it's myself. So today, with the topic which we are discussing today is called Abdominal Aortic Aneurysm, which is a screening. And yes, indeed, it's a really hard way to pronounce. So today's topic is Abdominal Aortic Aneurysm, and it is an aneurysm which is about arteries and veins, and definitely because I cannot able to pronounce the words properly, so definitely it's not me who will be talking about it. We do have a very nice guest sharing. We have a very nice guest in our studio, and he is none other than Dr. Mr. Nadim Noor. Assalamu alaikum, Dr. Saab.
Assalamu alaikum.
And he is the Consultant Vascular and Endovascular Surgeon from Luton Hospital and Bedfordshire Hospital. How are you, sir?
I'm very good, thank you very much. Thank you for inviting me today.
Good evening and welcome. And why don't you start by telling us about yourself first?
Yes, so as you said, my name is Nadim Noor. I'm a vascular and endovascular surgeon at Bedford and Luton Hospital. In fact, we cover a population of between Bedfordshire, Milton Keynes and Luton, so just under 1 million people.
Wow.
So we treat vascular disease, arterial and venous. In fact, we treat most of the arteries in the body apart from the heart and the first part of the main artery as it comes out of the heart. I have been vascular surgeon for the last 13 years. I'm clinical lead for the service in this area. We cover, as you said, we also do abdominal aortic aneurysm repairs in this within this region. My interest in vascular surgery developed quite a long time ago when I was training, and I've seen quite significant problems related to abdominal aortic aneurysm, and that's why I'm here today.
Wow. For people like us who have no idea about aneurysm and aortic aneurysm and vascular surgeon, so why don't you tell us about what is vascular surgery itself, and then tell us about the aneurysm as well?
Right. So the aneurysm is simply means a dilatation of an artery. It's kind of like, and it can happen to any part of the arterial system. The artery bulges out like a balloon, and as it does so, the wall of the artery gets stretches and gets weaker. There's obviously a risk that it can burst as the wall gets weaker. The aortic aneurysm, the aorta is the main artery in the body, which starts as from the heart and carries blood down and through the chest and into the abdomen. The topic that we are discussing today is mainly related to the part of the aorta, part of the main artery in the abdomen.
So the abnormality of that aortic arteries, aneurysm, that is. So, is it very common?
It is reasonably common. In general, about I think that 3 to 4% of the men can suffer from this condition. In the screening program, we find that about 1% of the men that we screen have an aneurysm of some size. 0.5% of the men that we screen would have an aneurysm that would need treatment.
Okay. And on that note, I must say, let me involve our listeners as well. So, listeners, if you have any questions or queries regarding our topic today, or if you just want to know a bit more about our topic today, please get involved and call us on 01582 481822. I repeat, 01582 481822, or you can send your questions by WhatsApp or text messages on 07779 481822. I repeat, 07779 481822. Now, Doc, you were telling us about the main abnormality about this aneurysm. So, what is the common cause of abnormality of aortic aneurysm?
The simple answer is that we do not know why people have aortic aneurysm, or any aneurysm for that matter. In general, we know that it is associated with age. For example, people develop aneurysms as they grow older. We know that people who smoke are more likely to have an aneurysm. High blood pressure has been found to be associated with the aneurysms, but in fact, no definite kind of cause can be found for the aneurysm. People just it is considered to be a degenerative disorder where there is some defect of the connective tissue, of which all our bodies are made of, and in particular the wall of the arteries are made of connective tissue, which may be weak and therefore stretches because of the abdominal the blood pressure within the artery.
So, डॉक्टर साहब, if you don't mind, मैं अगर इंग्लिश उर्दू दोनों को मिक्स करके चलूं, क्योंकि हमारे बहुत सारे लिसनर्स उर्दू में भी हैं, और ये एक ऐसी बीमारी है या एक ऐसी एबनॉर्मलिटी है जो कि अक्सर बेशतर लोगों में पाई जाती है, और इट्स गुड टू प्रोवाइड इन्फॉर्मेशन इन बोथ लैंग्वेज. सो इसलिए मैं चाह रहा था कि आज का टॉपिक हम थोड़ा मिक्स करके भी चलें. तो इसी को ज़रा आप अगर उर्दू में बता दें तो थोड़ा सा हमारे जो दूसरे लिसनर्स के लिए भी आसानी रहेगी.
बिल्कुल, मैं ज़रूर कोशिश करता हूँ. मैंने बताया था कि इंग्लिश में कि एनोरिज्म इज़ सिंपली, इसका ये मतलब होता है कि आर्टरी जो है वो बड़ी हो जाती है, सूज जाती है गुब्बारे की तरह, और उसकी वजह ये होती है कि इसकी जो आर्टरी की जो वॉल है, जो इसकी जो साइड्स हैं वो कमज़ोर होती हैं, और उसमें जो ब्लड प्रेशर की वजह से ये थोड़ा सा वो बल्ज कर जाती हैं, थोड़ा सा उसमें गुब्बारा सा आ जाता है. ऐसे जैसे वो गुब्बारा जब फूलता है तो उसकी जो वॉल्स हैं वो कमज़ोर हो जाती हैं और जब उसमें अगर हवा भरते जाएं तो वो फट जाता है. इसी तरह से अगर एनोरिज्म जो है वो बड़ा होता जाए और उसकी जो वॉल्स हैं कमज़ोर होती जाएं तो आहिस्ता आहिस्ता एक वक्त ऐसा आ सकता है कि वो फट जाए और उसमें से जो मतलब इसका ये होगा कि जो उसमें जो खून है वो फिर लीक होना शुरू हो जाता है. आम तौर पे अगर जो फटना जब एनोरिज्म फटता है या आर्टरी का जो ब्लीडिंग होती है वो उससे जान का ख़तरा भी बढ़ सकता है.
अच्छा, तो ये क्या बहुत आम है लोगों में या ये बहुत ख़ास है या बहुत कम लोगों को होता है?
सो इट्स डिफ़िकल्ट टू मैं जो कि एक मेरा काम ही ऐसा है कि इस तरह के केसेस को रोज़ देखना है तो उसमें मुझे ये लगता है कि ज़्यादा कॉमन है. लेकिन मेरा नहीं ख्याल कि ये 4 या 5% लोगों से ज़्यादा मेन पर्टिकुलरली जो 4-5% मेन जो हैं वो उनमें पाया जाता है यूरोपियन कंट्रीज़ में. जो
तो ख़वातीन के निस्बतन मर्द हजरात में ये ज़्यादा होता है?
ये ज़्यादा कॉमन है मर्दों में, औरतों में भी हो सकता है लेकिन ज़रा ये उसकी जो प्रेवलेंस है या जो वो थोड़ी सी कम है औरतों में निस्बत मर्दों से. और लेकिन ये है कि जब औरतों में होता है तो इसको ये इट कैन कॉज मोर प्रॉब्लम्स. उसकी अगर हम जब बात चलेगी तो आई कैन एक्सप्लेन लेटर एज टू व्हाई. लेकिन ये है कि यस आजकल ये मर्दों में ज़्यादा कॉमन है औरतों की निस्बत.
ज़ाहिर सी बात है, हम लोग अपनी चीज़ें अपनी तकलीफ अपने अंदर रखते हैं.
हाँ जी, बिल्कुल 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 बिल्कुल. मर्दों ये कहते हैं कि मर्द हमेशा जो है वो शॉर्ट स्ट्रॉ उसको ड्रॉ करता है. तो इससे इस तरह से ये है कि ये मर्द ही तकलीफ़ें बर्दाश्त करता है.
सॉरी अबाउट द लेडीज, मैं बायस नहीं हो रहा हूँ लेकिन एक जैसे इट्स जस्ट फॉर फन आई सेड दैट. अच्छा, in terms of the treatment options, so people who do have that, it's a really long name. Can we shorten it to something?
आप इसको AAA भी कह सकते हैं या AAA आप कह सकते हैं. आमतौर पे इसको हम abbreviation इसी तरह से यूज़ करते हैं.
ठीक है. या
aortic aneurysm कह सकते हैं, abdominal aortic aneurysm की बजाय so aortic aneurysm कह सकते हैं.
Aortic aneurysm. So AAA aortic aneurysm ये जो है इसकी अगर किसी को diagnosed होती है तो what are the treatment options and how did they get treated?
So आजकल के ज़माने में मॉडर्न एज में अगर इसको ट्रीट करना हो तो 2 तरीके हैं. एक तो है ट्रेडिशनल मेथड जो है वो है ऑपरेशन का, जिसमें हम लोग एक फैब्रिक की जो ट्यूब है उसको वो यूज़ करते हैं रिप्लेस करने के लिए पार्ट ऑफ द एनोरिज्म जो कि पार्ट ऑफ द आर्टरी जो कि एनोरिज्मल है. सो जो एबनॉर्मल पार्ट ऑफ द आर्टरी है वो हम निकाल देते हैं और उसमें जो आर्टिफिशियल जो ट्यूब है वो फिक्स कर देते हैं. दूसरा तरीका आजकल जो है वो है एंडोवास्कुलर रिपेयर, जिसमें हम एनोरिज्म के अंदर एक स्टेंट फिक्स कर देते हैं, जिससे ये है कि खून जो है एनोरिज्म की जो सैक में से जाने की बजाय वो उस जो आर्टिफिशियल स्टेंट है जो कि एक बेसिकली फैब्रिक की ट्यूब है उसमें से वो गुजरता है.
सही. So what in your personal opinion is better as compared to?
दोनों जो तरीके हैं, both methods have their pros and cons. The open method of repair requires an operation on the abdominal wall. That means a big cut on the abdomen. It is a bigger operation and there's an upfront risk to life. It is a big operation, so there is a risk to life, and that is around 5 to 6%. That means that if we were to operate a mixed kind of population of 100 people, then 5 or 6 of them may not get through the operation. The endovascular repair जो कि आप की होल भी कह सकते हैं, सब लोग उसको पसंद करना चाहते हैं, लेकिन it's not entirely keyhole. It's a shorter procedure in the sense that you can go home the day after the operation. There is no big cut on the abdomen. We access the arteries from the groins and pass some wires and things into the artery under X-ray control. and by this way we fix the kind of stent inside. So it is the upfront risk of to life with endovascular repair is 2 to 3%. The cons of the endovascular repair is that we have to keep an eye on this. Because the stents that we fit inside the artery are just lying there because of the internal kind of forces so the stent is trying to expand and the artery is trying to contain it, and that's how the stent and there are small barbs around the top of the artery, top of the stent, so it gets fixed in there, but it can move. It can get blocked, and sometimes there are some leaks develop inside around the stent, and that can obviously cause problems and may require some further treatment during the course during the rest of the life, basically. And that way there's around 1% risk that the aneurysm may in fact burst, despite having had it treated with the endovascular means. So there are cons of the endovascular operation. Though the upfront risk is low, there is ongoing issues can occur with the stent. On the open repair, the upfront risk of to life is higher, and it requires longer stay in the hospital and longer recovery period. But once it is done, there are smaller risks, lower risks of anything going wrong in the future.
Okay. I have a couple of questions on Facebook. One of this is, what is aneurysm? I'm not sure what time they have asked that. I think so you just covered that, but just a quick
I will just quickly say that again. So aneurysm literally means dilatation of the artery. So it is just a bulge or swelling of the artery because of high pressure within the arterial wall.
Okay. If you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. The question number is 01582 481822. आप इंग्लिश में या उर्दू में सवाल भी कर सकते हैं. And if you have any question, if you can't call or you are unable to make that call, or you're a bit kind of shy like myself, no, I'm not. So you can still send text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. So, Dr. Saab, I know it's not easy, but how do we get this scanned, this abnormal aneurysm?
So, I'll just take a step back, if you don't mind,
yes,
Matin. As up to a few years ago, most of the aneurysms were found incidentally because they do not cause any symptoms. People remained unaware of its presence and were found only incidentally when they had either an examination by a good doctor or an investigation for something else, like an ultrasound scan or CT scan, and they discovered an aneurysm. That was if they were lucky. If they were unlucky, then the aneurysm was found only when it ruptured. And then obviously, that is completely different kind of pathway, because the majority of the aneurysms, when they rupture, the patients do not survive. So 95% do not even make to the hospital.
तो जो हम लोग अक्सर बेशतर सुनते हैं कि यार वो बंदे की जवान उम्र में जो है अचानक से अंदर से लगे फट गई और हो गया.
It is slightly different, Matin. The जवान उम्र में जो लोगों की नसें फटती हैं वो usually दिमाग में होती हैं. That is a different type of aneurysm, and within the skull, within the brain, and that can rupture as well at a younger age. That is called berry aneurysm. That is slightly different. This one usually is found after the age, certainly after the age of 50, but usually from 60 to 70, 75 years of age. It can be later in life as well if it has not been found earlier. So what I was saying was that so when the aneurysm rupture, ruptures rather, the majority of the people cannot make it to the hospital. The ones who do manage to come to the hospital, only 30% of them survive. So the mortality really is very high for people who have a ruptured aneurysm. So with that in mind, we have the government then started a screening program by which we screen all men at the age of 65 years with a simple test which can diagnose an abdominal aortic aneurysm. And so the idea is to find the aneurysm early and treat it electively so that we could save lives.
Okay. Wow. So इसको जो है जो screening program, the screening program itself, is there any age limit for that one?
Well, in a way, yes. So every man, when they turn 65 years, they will be invited to participate in the program. So
just like national screening programs.
It is a national screening program. Okay. So they will get a letter in the post to come for screening. However, we also recognize that the program has started recently, and there is a big population of men who will not be invited because they are older than 65. So they can self-refer themselves, so they can call the screening office at Bedford Hospital or the local screening office if you are not in the Bedfordshire, Luton or Milton Keynes. Then you can call your local hospital and ask them to put you through to the local screening office, and you can ask for a scan. It is open to men only, though, not to women.
Oh, so it's it's something exclusive for us. I love that, but it's nothing to love about that.
It is just because it is more common in men, and the cost effectiveness of the screening program is proven for men only at the moment.
All right, okay. So okay, in terms of men itself, and if they live that long, because unfortunately, men has a very short life as compared to women in our country. So, what are the chances if we compare them between men, female, male and female? What is the difference between in terms of?
So I referred to this earlier, that if women may have aneurysm at an earlier age, if they may rupture at a smaller size, and when they do get treated, they are more likely to have problems. So unfortunately, the nature of the disease is slightly different in women as compared to men. It is less common, but when they do have an aneurysm, they're more likely to have a family history of the aneurysm, and then they should be treated. For example, I don't think we have talked about it, but maybe we should talk about the size of the aneurysm, if you don't mind. Getting there. Is that okay to go ahead with that?
Yes, we will be going on a break in 5 minutes, few minutes time. But
yes,
please.
Okay. So
if we go in, then I have to break you.
We will then resume afterwards. Yeah. So normal aorta is about 2 centimeter in diameter. It is aneurysmal when it is 3 centimeter in diameter. We recommend treatment when it gets to 5.5 centimeter in diameter. The reason for that is that the risk of it rupturing increases at that size, and the risk of surgery is comparatively low. Okay? Now, we would treat a man at 5.5 centimeter when they are 5.5 centimeter in diameter, but we'll treat a woman at 5 centimeter in diameter.
Okay.
So that is how the women are different.
So in terms of the size itself, 5.5 centimeter in terms of vein size, it's really, really big. It's like a big spot if for people if they know.
Yes.
And that means it's really, really...
Yes, so there is always anxieties when men have been diagnosed with aneurysm, and which is not in the treatment range yet, then they are anxious, and we can all kind of reassure them that the risk of rupturing at a size below 5.5 is is small. We recommend treatment based on the risk and benefit analysis. So the surgery, as I alluded to earlier, also carries risk to life, and ruptures carry risk to life. So we have to compare the risk of rupture against the risk of surgery. So at 5.5, the risk of surgery is lower compared to the risk of rupture, and that's why we recommend treatment at that level. Below that, risk of surgery is higher, and therefore we do not recommend it.
Okay, we will discuss a bit more about it, because unfortunately we are going on break, and unfortunately, yes, it is true, the time has passed really quickly. So when we come back from break, we will talk a bit more about this aneurysm and the benefit and the pros and the cons of the screening program and the other details as well. Stay tuned.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I am your host Fahad Matin for today's evening, and today we are talking about Abdominal Aortic Aneurysm, which is AAA screening program, with our guest, Mr. Dr. Nadim Noor. And he's the Consultant Vascular and Endovascular Surgeon from Bedford Hospital and Luton Hospital. Assalamu alaikum, Dr. Saab.
Walaikum assalam again.
This program is broadcasting live today on Thursday, 11th of July 2019 from the studios of Inspire FM for our lovely people in Luton and the surrounding areas of Luton like Dunstable, Harpeth and Bedford. And through our airwaves and our website and our web app, reaching all over the world. So good evening and welcome back. Before we went on break, we were talking about the screening program itself, and I was pretty much scared when Dr. informed me that the sizes are up to 5 inches, 5.5 inches at the time of surgery, and I was literally, sorry, not inches, centimeters, my mistake. And I was literally scared. You can see that I was scared. And during the break, I was having a word with Dr. Saab as well. So, Dr. Saab, sorry, let me come back to that area. What are the biggest size of arteries you have seen? I mean, the aneurysm you have seen.
So, yeah, well, it's difficult to say. Most of the large aneurysms that we see are the ones who come in a ruptured state. So we have seen up to about 9, 10, 12 centimeter aneurysms.
Wow.
We tend to, when somebody is found to have an aneurysm of, say, 7.5 centimeter, then we will tend to admit them to the hospital to, not that they are at immediate risk, but because we would like to treat them as soon as possible, and we will investigate them quicker if they are we can investigate them quicker if they are in the hospital rather than as an outpatient.
Wow. I am extremely surprised because I thought the biggest sizes are somewhere between 3 and 4 centimeters, not more than that. But I'm surprised. That's a big size, I must say.
It is indeed. The problem is that you can't predict which aneurysms will rupture. We don't know of any factors which contribute to the rupture of the aneurysm. So the aneurysm of, say, 5.5 centimeter can rupture, or it can carry on and continue to grow bigger and bigger until it gets to, say, 8 centimeter and then rupture. So it is very difficult to predict what will happen to an aneurysm.
Okay. Wow. Okay. Let me involve our listeners as well. So, listeners, if you have any questions or queries regarding our topic tonight, or if you just want to know a bit more about anything about our topic today regarding aneurysm or any abdominal aneurysm or abdominal aneurysm, please give us a call on 01582481822. अगर आप चाहें तो उर्दू में या इंग्लिश में दोनों में सवाल कर सकते हैं. आज हम दोनों वी आर ट्राइंग आवर लेवल बेस्ट कि हम दोनों ज़बानों को कवर कर सकें एक्सप्लेन करने के लिए इस बात को. और उसके अलावा if you guys want, you can send your questions via text messages or WhatsApp on 07779481822. I repeat, 07779481822. So, डॉक्टर साहब, आपसे थोड़ा सा टॉपिक के अंदर ही है लेकिन थोड़ा सा हट के बात है कि जो स्क्रीनिंग प्रोग्राम्स हैं हमारी, जैसे कि आपका ये है ट्रिपल ए स्क्रीनिंग प्रोग्राम, हमारा जो एशियन पॉपुलेशन है उसकी कितनी बड़ी तादाद आती है या कितनी बड़ी तादाद अवॉइड करती है इसको?
Yes, so this is my concern really, because I am during the introduction I forgot to mention that I am also the clinical director of the AAA screening program for Bedfordshire, Milton Keynes and Luton, and one area of concern for me is that when we invite men from the Asian population from Pakistan and Indian origin, they tend not to come for screening. And the one purpose of me coming here today is actually to promote the screening program, and I don't know whether it is lack of awareness or whether it's a language problem or just inhibition. Sometimes we try not to find the problems with our bodies because then you will have to go and get that right, so maybe it is that. But our people from Asian background, Pakistan subcontinent background, they tend not to come for screening.
So are there any more risk than the white affluent population?
Difficult to say. What I have seen in my practice, not necessarily related to the aneurysms, but general practice with vascular disease, is that the population from Asia, from subcontinent, not necessarily Asia, have a higher kind of load of disease. So they age earlier. For example, they look more, frailer at a particular age. They are more likely to have diabetes. They're more likely to be smoker. They are so they're more likely to be unhealthy and unsatisfied with their health. And I'm wondering whether that contributes towards their preferences not to come for screening.
I just a question just popped on my screen and it says, is this a national screening program?
It is a national screening program. We are part of the national screening program. The national screening program is kind of divided into several local areas. We cover a population of about 1 million within Luton, Bedfordshire and Milton Keynes. There's a neighbouring program, for example, in Hertfordshire, which is based in West Herts and Lister, Stevenage, and they cover a population of about 1.5 million. So yes, we are part of a national screening program.
Okay. In terms of the screening itself, what does happen? Does people come in to go through like some kind of tests or something?
Yes. So all men, when they turn 65, they are invited for screening. The screening venue are usually in the community, in the GP surgery, so easy to get to, and there are not as many parking problems as the Luton and Bedford hospitals have. When you get to the screening, you'll wait in the waiting room. Your name will be called when your turn has come. The screening technician, who is usually an ultrasound trained technician, will introduce himself and take you through the procedure. Will give you some information about the aortic aneurysm and the program, and ask you a few health questions. He will also ask your consent or agreement to share your information, your personal data, because your name and the aneurysm details, or if there is an aneurysm, your health details will be entered into the aneurysm screening program database. So he will ask your permission for that. He will ask your permission to scan you. The scan itself is simply an ultrasound scan, which is the same scan that the ladies have when they're pregnant. So it's a baby scan. It's the scannist will put a little bit of gel on the abdomen and with a probe scan. It does not hurt. It does not cause any pain or discomfort. There is no exposure involved, but just apart from the exposure of the abdomen. So there is no concern. I know that our people are sometimes a bit shy, so just to reassure them that there is no major exposure involved with that. The screening technicians can be a man or woman, but they are very professional, and they have a knack of putting people at ease. So the whole process will take probably about 10 minutes. After the scan, they will let you know there and then what they have found. If they have found an aneurysm, then they will tell you that there is an aneurysm, and yes, you will get an appointment with the specialist vascular nurse for further kind of advice and help. If you do not have an aneurysm, then that is it. They will tell you that you don't have an aneurysm. You will go home with peace of mind, nothing to worry about.
Wow. Okay. So, how long does this process take normally?
So the process will take 10 minutes once the technician calls your name. Obviously, there might be a little bit of wait involved when you come to the venue.
Okay. So, and you said it's not in the hospital itself, so it's normally in outreach centers in
majority of the screening scans are organized in the community in the GP surgery most of the time.
Oh, GP surgery.
GP surgery. So there is a familiar environment for the patients, for the people. They are not patients. But we have started to scan to hold a few clinics in the hospital, because some people we have find it easier to get to the hospital. Particularly Bedford and Luton hospitals are based very much in the community. They're in the center, and some people find it easier to get to them. So we do some clinics in the hospital.
Okay. So in terms of community centers or GP surgeries, as you said, so there are different GP surgeries in both Bedford, Luton, and Milton Keynes.
That's correct. We vary the venues from a place to different times of the week and month, depending upon where we are screening at the time. But the venues are usually there are certain GPs surgeries which have space for us to hold this clinic. So not all GP surgeries, but some GP surgeries. And when people will get the letter for basically the invitation for the screening, they will be told where their screening is likely to be held. Now, if it is inconvenient, then it will be reasonable for them to call the screening office direct and request a different venue, which is more convenient to them. And if you want, I can give you the number for the screening.
Please, sir.
So number to call is 01234 792 207. 01234 792 207. And this number you can also call if you are older than 65 and concerned about the aneurysm and want to have a screening scan done. If you are a man above 65, you have not been screened before, then you can call this number and request a screening scan to be done.
अच्छा आपने जैसे कहा है कि अगर आप कंसर्न हो अबाउट दिस सो इसकी कोई साइंस या सिम्टम्स है कि क्या चीज़ है जो कि इंसान जो है वो कंसर्न हो सकता है?
Unfortunately, the aneurysm is a silent condition, and I call it a silent killer, because if it is not found, then it can cause serious problems to health and can risk life. So no, it has no signs and symptoms, and if it is remains undiscovered, then it can rupture and may cause death of the individual. So the concerns, some people may be concerned if they have heard about it, if somebody close to them, a friend or a relative, have died because of the aneurysm or has had treatment for the aneurysm, or they may get interested after listening to this program, or some other information in the media or from word of mouth. So if there is people are concerned or people would like to be screened, it's not necessarily yourself. If your dad, for example, your granddad, if you're listening to this program and you are you're concerned about the health of your loved ones, then it is absolutely right to ask your dad or granddad to call this number. And I'm going to give this number again, 01234 792 207, and ask for a screening scan.
Gotcha. And could someone when they have a scan, so if someone went for a scan and get the scan done and yada, how soon they will find out whether there is any risk to their health or not, and what's the answer of those scans?
So if they have a scan and an aneurysm is found, basically the results are given there and then.
Oh, okay.
Yeah. So the screening technicians are trained to provide the information. So they're trained to look at the aorta, and they are trained to give the information out to the individuals, to the people. So they will tell you, one, you do not have an aneurysm, therefore your mind is at ease and you can go home and enjoy your life. Or they will tell you that you have a small aneurysm. If you have a small aneurysm, that is, say, 3 centimeter or 3 to, say, 5.5 centimeter, so they would then advise you that you will have a regular surveillance scan. So what we'll then need to do is to keep the aneurysm under observation. So if it's a small aneurysm, say 3.3 centimeter to, say, 4.5 centimeter, then you will get scanned every year. So you will get a letter or invitation to come for a surveillance scan every year until it gets to the size, say, 4.5, where the frequency of the scans will be increased to, say, 6 monthly. Once it gets to 5.5 centimeter, then you will be referred to the vascular service, like to me, for treatment.
Oh, right, okay. So the screening itself is not a problem. It's much easier, and the answers. I'm a bit surprised that the answers can get then and there right away, which is really good. So if a patient has, let me talk from the devil's advocate perspective,
sure.
and somebody a person who's in that age range came just because he or she has been invited for a AAA screening, and the technician found that the aneurysm is 4.5 to 4.8 centimeters, 5 centimeters. So what will happen then?
So if the aneurysm is between 4.5 and 5.5 centimeter, then they will let's say 4.5 to 5 centimeter, then they will still be kept under surveillance, that is regular observations with an ultrasound scan at 6 monthly interval.
Okay.
Once it gets to 5 centimeter, then the frequency of the scans is increased to 3 monthly. So you will then have surveillance or observation scan every 3 months until it gets to 5.5 centimeter.
So why delay so much? That's one of the reasons I was asking.
Yes. So why do we wait until the aneurysm gets to 5.5 centimeter? Why do we not treat it earlier? The simple reason is that the surgery or the treatment itself carries some risk to life. And we have to weigh the benefits of the surgery with the risks of the rupture. And over the years, and with several kind of studies, we have found that the risk of rupture of an aneurysm below 5.5 centimeter is lower compared to the risk of surgery itself. So we therefore prefer to defer surgery until the aneurysm is large enough to pose a risk to life.
And the smaller aneurysm does not pose any
The smaller aneurysm can rupture, but rarely.
Okay, so because of the risk of the operation itself, we do not get.
That's right.
All right. Okay. Now I got it, because I was a bit kind of confused in terms of the aneurysm itself. Now, in terms of the abdominal as well, because you said it starts from the cardiac side, from the heart area, goes all the way to abdominal area. So, what comes in the abdominal area? How problematic it will be in the abdominal area?
So
the upper side and
the aorta. I think I get your answer. So I think as a question rather. So I think the aorta starts from the heart, as the pipe that carries blood from the heart to the rest of the body. It starts at the heart, and all parts of the aorta can get aneurysmal. However, for some reason unknown, the abdominal part of the aorta gets more commonly involved. The part in the chest can also get bigger, but less commonly. We do find aneurysms in the aorta, in the chest part, and we can treat them as well. And if somebody has an aneurysm of the abdominal aorta, then they will get a CT scan once we have decided that the aneurysm is in the treatment range. Then they will get a bigger scan of the whole of the aorta, and then if there is an aneurysm higher than the abdominal segment, then that will be diagnosed as well, and we will then be able to suggest some treatment for that.
Okay, wow, okay. Let me involve our listeners as well. Listeners, if you have any questions or queries regarding our topic today, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send text messages or WhatsApp on 07779 481822. Wow, I just noticed the time. The time has passed really, really quickly. It's only 4 minutes remaining to our topic tonight before we end. So let's do a quick round of catch-up in terms of what it is and how it is and what it covers and why it is a problematic problem itself to our health. So if we do a quick round of catch-up in what we have done so far in a summarized way, what will you say, sir?
Right. So the aneurysm is a dilatation of an artery, and today we are talking about abdominal aortic aneurysm. It is the main artery that comes from the heart in the abdomen. When it dilates, it becomes bigger, like a balloon, and it can rupture if it remains untreated. If it ruptures, it can be fatal. And therefore, the government has introduced the aneurysm screening program, by which men at the age of 65 years, or when they are by self-referral at a later stage in their life, can have an ultrasound scan of the abdominal aorta to diagnose aneurysms at an early stage, where they can be treated safely and effectively, and thereby we can reduce the risk to life at a later date. So we are trying to find the silent killers at an earlier stage by a simple, painless test and treat them effectively at an earlier stage. So that is my message today, and the message is for everybody, but particularly to people from subcontinent, men from the Asian community who are for some reason reluctant to come forward for screening. And I'm really urging them to come for screening so that we could save their lives.
And in terms of those people, especially from the subcontinent itself, if they do like to get involved, they just call on that number which you have said?
They can call this number, and if they require information in a different language other than English, they can ask for that kind of information too, and we can send them information leaflets and stuff in that language too.
Okay, and the number is?
And the number is 01234 792 207.
Okay, and in terms of the positive message of the day as well, I remember you said that the best thing to do to avoid these kind of problems is to have a healthy lifestyle, which unfortunately our people do not have, especially when they cross the lines of 50s and 60s.
Yeah, absolutely. So I think positive message that I would really want to give out today is that the risks of the aneurysm surgery come from the ill health. From the risks come from heart, lung complications of heart, lungs, kidneys, and bowel. And I think the problem with our people from a subcontinent background is that we are more likely to have diabetes because of our eating habits. We are more likely to be overweight because of our eating habits. We are more likely to have lung problems because of our smoking habit. And I think and we're more likely to have heart disease because of diabetes, eating habits, and smoking. So I think we need to really look at our lifestyle. We need to be more active. We need to be slimmer. We need to look after our diet. We need to eat healthy, more vegetables, less fat, less mithai, and we need to kind of make sure that we don't smoke. Smoking is a killer which causes cancers. It causes arterial disease, and it contributes towards aneurysm. And I think we should stop smoking in en masse. All of us, we should stop smoking.
Definitely. Thank you so much, Dr. Saab, for coming to our show. And I must say,
pleasure.
It's a pleasure to have you for the very first time. And definitely, this is not the last time we will have you again.
I would love to come back. It's my pleasure to be here. Thank you very much for having me.
Thank you so much for being part of our show tonight. And that's all, folks, for tonight. If you have missed any part of the show, you can always go to our Facebook page, or you can listen to our podcast, or if you like, you can go to Inspire FM pages as well and listen to our podcast or view our show on our Inspire FM Facebook page. But until next week, please remember us in your duas, and definitely we do like to be remembered in every single duas. Until next week, I'm your host Fahad Matin saying Assalamu Alaikum.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.